Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could join us for my next distinguished guest, Debra Buonaguidi. Debra, you are a clinical esthetician, and you are certified by the California Educator of Aesthetics. Debra, thanks so very much for being here.
Thank you for having me.
Debra, there's a lot of misconception about what an esthetician does and about skincare and how the skincare specialist can work together with the plastic surgeon and dermatologist, etc. But before we get on to that, I'd like to teach the audience a little bit about what you do. Tell us about your normal day and tell us what your week is like as an esthetician.
As an esthetician, I have a private practice, so I work within a doctor's office myself, my practice. And a normal work day is when I have new clients coming in, I always have a client card that they'll be filling out for me, and my appointments are booked out. Usually I give them like an hour each, but I stay pretty busy. I work, right now I'm working 2 days a week, and I work from like 9 in the morning to 9 in the evening. I've got clients that come in late, but it's a very fulfilling and wonderful job, and I'm actually opening a new practice which will be addressing oncology patients. That will be, because I myself was one, so I know exactly the skin compromises and things that happen when you go through chemo and radiation.
Well, Debra, that's wonderful. And part of the reason I invited you to come on this program is because I've seen some of your clients, customers, patients, whatever you'd like to call them, and they have really wonderful looking and feeling skin. And I really admire what you do. So what I'd like to do is teach our audience what an esthetician can do to help maintain healthy skin. And if we can take a few minutes to talk about what we can do and if it's possible to reverse some sun damage. Now, of course, anybody who lives in California and loves the outdoors, eventually they're going to get some sun weathering of the skin. Isn't that correct?
Absolutely.
So let's back up for a moment and talk about how an esthetician can help maintain healthy and good-looking skin. What can an esthetician do?
I work in partnership with my clients, and usually when people come to me, they have seen something unsightly, be it a hyperpigmentation or hypopigmentation.
So Debra, I appreciate that, but let's teach our audience what we mean by hyper or hypopigmentation. What do you mean by that?
Those are directly associated with the sun's exposure, and people, what has happened is the melanocyte activity in the skin has been overstimulated by the sun, and it's caused a demarcation on the skin.
Okay, so I want to teach our audience. So a hyperpigmentation is a darker spot.
Correct.
Right? Some people call those sunspots or liver spots or age spots or lentigos, we can call them medically.
Yes.
And hypopigmentation is a pale spot or patch, correct?
Correct.
So those are signs of previous inflammation or sun exposure. Actually, different things can cause that.
Absolutely, absolutely.
So how can you help a person maintain healthy skin or improve the health of their skin?
Well, the first thing I wanted to recommend is that your best friend for your skin and yourself is sunscreen, sunscreen, and sunscreen. That's probably your best preventative. From there, when we can do things in the actual clinical setting where I'm very realistic, I'm very progressive than aggressive when it comes to addressing that particular issue, the hyperpigmentation. But educating the patient as realistically what we can accomplish as a partnership. And the products that they have now are very natural-based botanicals, so it's a very, a period of time goes by, but we get a result that is phenomenal, and you've seen it with some of my clients. So it's definitely once the client is been in my chair, I've educated them on home care and how to use the products to maintain and then take it to the next level and improve the health of their skin.
Okay, Debra, let's talk about a few specific things, okay? And I want to emphasize something that you said. What I tell my patients in my office, that the two most important things that they can do to improve or maintain the health of their skin is, number one, avoid the sun, as you said, sunblock or a big hat, proper clothing. And number two, no smoking.
Correct.
Isn't that correct?
Absolutely.
The number of oxidants, everybody hears about antioxidants being good for you, but the number of oxidants in one puff of cigarette smoke is thousands.
Yes,
correct?
Absolutely.
So if people can learn to avoid smoking and minimize their exposure to the sun, that's a good start, right?
Right.
Now, what about proper skin cleansing? Everybody wants to know how to properly cleanse their face, but not to dry it out, correct?
Correct. I've always believed in not overstimulating the skin. So in a cleansing process, you're always going to, first of all, realize that you have dry skin, oily skin, and get the proper cleanser. But when someone is cleansing their face, these are your best tools. And to stay away from towels or face cloths, because you can overstimulate, and then what happens, you get in this kind of a constant, you get too oily because you've overstimulated the skin. So gently cleanse your face, tepid water, and not real extreme hot or cold. And just a good cleansing and rinsing where you're using your hands to cleanse and walk around the eye area and the mouth, and cleansing really good around the nose area. And this is usually the area that hits the elements first, and this is where I see the most, where people need to cleanse a little bit more on the nose and down the chin and the décolleté and the neck.
Debra, do you recommend that people use common facial soap, or do you recommend special cleansers?
I would recommend stay away from soaps that are too alkaline, because that's drying. But if you go towards soaps that keep your skin the pH of 5.5, you're not going to get the extremes, drying or too much acid in them. So definitely there are gentle facial cleansers, and it is one of the most important part of when you get into cleaning. Then you go into your exfoliation process where you want to exfoliate too.
Debra, perfect segue. Let's teach our audience what we mean about exfoliation.
Well, there's physical exfoliators, and in particular, there's some that have licorice in it, which is an anti-inflammatory. And these physical exfoliators have little granules in them. And I recommend the ones that are encapsulated in oils, because you don't want to use pits or anything to exfoliate on your face. So if you get the ones that are encapsulated and use them, most of the time, most of your exfoliators you put on, leave on for 10 minutes, they dry, so they have an action where they're pulling out impurities out of your pores that are clogged. And then you just take the tepid water, or you can step in your shower and then use the exfoliants, the little granules that are in there, to exfoliate off any debris that's on the skin.
Okay, Debra, so let's try to define exfoliation if we can. So that's a way, it's almost cleansing, in a way removing the very top layer, removing the very superficial part of it, the very superficial keratin layer.
Correct.
That's not really desirable if it gets too thick, right?
Correct.
And exfoliation is a way where we can stimulate the germinal matrix or the basal membrane to make new baby cells, right?
Absolutely.
And hopefully not as sun damaged as the ones up to the surface.
Correct.
Correct? So we can do that mechanically, and we can do, sometimes the esthetician can apply, say, a fruit acid peel, is that correct?
There are different peels that you can use depending upon the condition that you want to address, but there are chocolate pills now. There's 5-berry pills that are, they smell good.
Sounds like frosting.
Exactly. Something you
Excellent.
can eat. But depending upon what we want to accomplish and our desired outcome, we can definitely do, we could say chemical, but they're botanically based. Some of these pills, for instance, there's blueberries and cranberries. There's different berries that will help exfoliate. And again, when you said fruit acids, that's what we're dealing with, fruit acids. Glycolics are sugar cane. Malic is basically apopectin. Lactic acid is milk, sour milk. So there are different acids that we work with. And then what I call the big guns is we pull out your modified Jesners, and those have resorcinol in them. And then what I find is the most effective for acne is salicylic acid.
Okay, Debra, I think it's important to point out that before I plan a peel for a patient, a more aggressive surgical peel, or I should say as I help a patient plan for that, I will oftentimes send a patient to an esthetician to help prime up their skin and begin the exfoliation process. And perhaps more importantly, start the process where we try to encourage and stimulate the germinal matrix and the basal membrane to make out more baby cells.
Absolutely.
Isn't that correct?
Yeah, anytime you send a signal down, you're taking off skin cells, it sends a signal down for those cells to produce at a faster rate. So you're absolutely right. And so like you say, you don't want to replicate any damaged cells, so it's an exfoliation process that constantly we're exfoliating off the debris, and hopefully the new cells that come up, they're not damaged. So you need to protect those cells with sunscreen and hats and everything. But yeah, that's part of that desired outcome, is getting that.
So I believe that some histologists can tell us that it takes about 30 days for the new baby cell to even get to the top where it's visible.
Correct.
And so sometimes when I hear people in the office say, well, I tried skincare for 2 weeks and I didn't see any difference. Well, they haven't even gone through the 30-day period for even one cell to get to the top, correct? One new cell.
Absolutely.
So what about how we can prepare a patient who's going to have some surgery or a chemical peel or a surgical peel or even laser? What advice can you give a patient about that?
Usually when someone, just like you, I take in their social engagements, weddings, things coming up, and we do what we call a series. So we have them, I tell them realistically, this is what you're going to see the first week. Then after you come back, you return in 4 weeks, because we're within that cycle. We again hit the skin, do the exfoliation with the peels, and we keep getting that layer, so I'm not constantly taking off that dead debris that keeps coming that's there, but I give that 4-week cycle, and then we hit it again. So I'd say I usually do six treatments, and they're about 4, and they don't come in any closer than 2.5, 3 weeks, but at least 4 weeks apart, and they get the optimal result to set their skin up for a procedure, be it plastic surgery. But what I do is cosmetic also, where we have a plan, we work together, and we get the desired outcome as far as if they're wanting to. What I find is a lot of women will get what they call cross-hatching, which is dehydration. So there's also a nutritional thing to where we need to drink more water, so I address that, or I see that, and that's one of the biggest things is dehydration. They definitely have to drink more water and get their skin at a hydration level for any kind of procedure, even what I do. So I send them home with home care, because at the end of those 4 weeks, and definitely within a week and a half, they start to peel, so they can exfoliate physically at home and get the dead skin off. And then they start seeing results that are very desirable.
Well, excellent. Now, Debra, let's touch on proper moisturization. So we've spoken briefly about cleansing. We've spoken briefly about exfoliating. We've talked a little bit about stimulating the new baby cells, the basal membrane. Now, what about properly moisturizing?
Moisturizing is very important, especially at night when your skin is repairing itself. It has a rhythm, and at night is when your reparative action is happening. So I recommend at night usually a different kind of moisturizer that's going to hydrate or address any, if it's acne, it's going to be a different kind of moisturizer, not a heavy one. It could be a gel-based moisturizer. But someone who's extremely dry, who we're prepping the skin, we're going to use something a little heavier. But vitamin C and E are probably one of the 2 most important nutrients that you have in a moisturizer that can create desired results and take you to the next level for reparative action. But during the day, you can wear a moisturizer, C&E, under a sunscreen if you're extremely dry, or the sunscreens they have now have environmental protection gels in them that hydrate your skin while also protecting you from the sun. So it all depends upon the client's skin.
Well, excellent. Debra, one thing I want to talk about is the facial. Everybody tells me I've been lucky enough to have a couple facials in my life. They feel great, but it's like a massage for the face. But besides feeling great, what can an esthetician do during a facial, and what benefits can come from getting a facial?
I think immediately the mechanical benefits, anytime your face is being stimulated, there's blood flow, there's exchange, there's oxygen exchange. So the skin cell benefits from the actual action of being massaged and stuff. And for me, I bring an element of a mind, body, spirit, where this is a very sacred space that I'm working in with someone's face. And I find that one benefit is a lot of times when they sit there, I'll take a spritz of organic orange or rose water and spritz it and just tell them, take a deep breath, relax, you're here, forget about your to-do list. We're going to sit here for the next hour and we're going to address your needs on your skin. And so you've got stimulation, you've got relaxation. Then we start addressing exfoliating, and I don't do what we call facials. I actually customize the facial for that particular patient. So I analyze their needs, what we need to do. There is some contras. If someone's using Accutane or Retin-A, I sometimes I have to change up the facial because those are some contras we have to be careful of. But basically, I've had acne patients who were teenagers that were very self-conscious about their acne, and over a period of time their self-confidence came back. They were able to wear their hair shorter or wear it back. Their acne was gone. I've had patients, in particular a woman who was a widow who had lost her husband 5 years ago, and as I was doing the facial and caressing her face, she started to cry. And I asked her, I said, "Are you okay?" And she says, "Well, my husband used to caress my face," and it
well,
just,
that's very sweet.
yeah, and
very
it's
sweet,
the
Debra.
connection of human beings and touching that. Also, you find that element when you're doing facials and
Very sweet. It's interesting what comes up with a human touch.
Absolutely.
Deborah, we only have a few more seconds left.
Okay.
I want to make sure we give out your name and number.
Okay.
Or if someone has questions about facials or estheticians and skincare, how can they contact you?
I've got my new practice, Skin Anew.
Skin Anew.
It's a pampering suite at 883 Lighthouse Avenue, and the number there is 333-0506. And I also have a new Skin Anew Pampering Suites.com. That would be the website.
Deborah, just the name makes me want to schedule an appointment. Maybe I could do that, and then I'll come
Absolutely.
back and give a report on how it was. Debra Buonaguidi, you are a skincare specialist, clinical esthetician. I'm so grateful that you came on the program. Thanks for being here.
Thank you.
One more time, Debra Buonaguidi, 333-0506,
correct.
area code 831.
Yep.
Thanks so much for being here.
Thank you for having me.
Once again, this is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and we're going to take a very brief pause for a very good cause.